Vincent Scully and welcome back to our series of videos looking at AcuGraph, its daily use and tips and tricks for getting the most of it in your practice. Today we're going to address a couple of questions that were asked quite frequently. One is, how long does an actual screening take? And two, what is the screening module? So to answer the first question, the actual screening of a patient, i.e. taking the measurements and readings from the hands and feet, can take anywhere from about 2 to 4 minutes, dependent upon your level of experience. When I say level of experience, we need to take into account what your point location skills are like. If your point location is quite good, then that's going to reduce the actual time it takes for you to find the points on the hands and feet. The second aspect that we need to look at is the actual angle and pressure applied when taking an actual AcuGraph screening. It's better to get consistent results. It's better to use the same angle and the same pressure on the points that you're using. Now, as the points are in different areas of the body, you've got to learn the pressure that's applicable to that specific area. And also with the aspect of pressure, you've got to look at how old the person is, how deep their energy is within their body. You've got to look at the actual weight of that person. A thinner person versus a larger person is going to require a little bit of the larger person is going to require a little bit of extra pressure to possibly reach that point. On the note of the energetic aspect of the point itself, as noted on the website and possibly in one of our other videos, the actual area of energetic influence, i.e. the electrical resistance that we're measuring, is within about a centimetre diameter. Now this is when points have a good distance between each other, and I say some points on the heart meridian, they're going to be quite close, so you need to be quite specific in those areas. But as your point location, as it improves, as the angle and the pressure of your probe action improves, you're going to reduce that time down. And another aspect of taking a measurement that I use in my own practice is I use that as an opportunity to employ my tone diagnosis. I also look at the eyes, so I can see any redness, any discoloration in the eyes. I can look at the skin texture on the face to look for any excess redness or paleness, etc. So you can combine, as you get more familiar with it, you can actually combine a number of different things at the same time. On to the point about the AcuGraph Screening Module. Well, the screening module, as its name would suggest, is a module designed for screenings. In our experience, we found that at certain times on a public screening, some patients may not be willing to take their shoes off, or in a lady's case may have stockings or tights that it's not practical to take them off. So the screening module was invented. The screening module itself looks at the points on the hands only. So you're using the 6 points on each hand, and it gives you the basis of a good diagnostic conversation with a view to carrying out a full exam at a later point. So on a time basis, it reduces your actual time for taking the readings down to less than a minute when you're quite quick. So it's a fast, efficient way of getting a reading that you can base a good conversation upon. And the most important aspect is the reading and the screening is less than half of the importance of your exam, because you need to take whatever findings you have, interpret those and explain those to your patients so that they understand exactly what's going on. Again, just by way of drawing attention to the reference aspect of AcuGraph, within the reference aspect, you also have the ability to print out a full report for that client, and those reports can be customized to have as much or as little in them as is available within the AcuGraph application itself. Okay, so I hope you found that interesting today. To close off, I'll just go over the 2 points. On the actual duration of the AcuGraph exam, it can be as little as 2 minutes and up to about 4 minutes. You're going to improve your actual time duration by way of the improvement of your experience when using AcuGraph, and those factors are your point location, the angle and the depth of the probe. And you will find out it's very intuitive, and you'll find out very easily your skills start to improve and you reduce that time significantly. The AcuGraph Screening Module, it's a downloadable aspect of the AcuGraph application, which can be purchased from our website, AcuGraphEurope.com, or from Meridia Technology at meridiatech.com. When you purchase this, you will receive an add-on to your existing registration with an unlock code, which will unlock that module for you. So you don't actually receive a tangible product, but you do receive an unlock code. Okay, I'm going to finish off today, and if you have any questions on today's video module or any other questions relating to AcuGraph, feel free, give me a call, drop me an email. I'm more than happy to answer any questions that you have. Thanks again, and see you on the next video. Bye bye.